All right, welcome back to Close Up. This past week, just days after members of Congress were sworn in, Republicans took the first step toward repealing the Affordable Care Act, known, of course, as Obamacare. So with the likelihood that a repeal will take place, what does it mean? What's likely to go? What's likely to stay? Here to answer some of those questions, hopefully, we have two experts in the healthcare field in New Hampshire, former HHS Commissioner Nick Vailas, and healthcare consultant and former Emergency Department Medical Director at several New Hampshire hospitals, Dr. Jonathan Burrows. Gentlemen, good to see you this morning. Thanks for being here.
Thank you.
Dr. Burrows, we'll start with you. We don't know what this is going to look like after Republicans have at it. What, from your standpoint, and I'll point out that this is an apolitical discussion, what needs to stay?
Okay, so everyone agrees that Obamacare is a flawed law, and it shouldn't be any surprise why it's flawed. It was created by Democrats, absent Republicans, absent the insurance industry, absent the pharmaceutical industry. So it doesn't really work for insurance companies. In fact, they spent a lot of money trying to defeat it back in 2010. And it's a flawed law. And there are many things that have to go. It doesn't work for insurance companies, particularly small insurance companies. There's taxes on durable medical equipment. There's the Cadillac tax. There's all kinds of very unpopular and dysfunctional things in the law that need to go away. That being said, there are four essential things that need to stay. One of them is the access to coverage for health care. The United States has 32 countries in the world that have a greater percentage of the population covered in health care. Why is that important? Because people like you and me who have health insurance are actually paying for people who don't have health insurance. And how does that happen? Well, next time you get an MRI or a CAT scan at the hospital or the ASC, ask your doctor, why does this CAT scan cost $2,000 when it's only a $295 procedure? And they'll tell you, cost shifting. And what does that mean? That means you're paying for poor people, you're paying for people who don't pay their bills. So it's a big deal.
So let's start right there, because Nick, we've talked about this before, and you talk about the prices, and you think, well, first, what do you think will be the first thing to go, the individual mandate or whatever when it comes to the ACA? And you're a big proponent of patients getting a little smarter about their choices.
Absolutely. I think what will be targeted first, and hopefully so, it's the mandate, the government telling you that you have to buy insurance. Healthcare, before the Affordable Care Act, healthcare, the delivery of healthcare in the United States, was in chaos anyways, and we just threw, with the Affordable Care Act, threw fuel on the fire. Healthcare is devoid of laws of economics, individual responsibility, and why are we surprised that it's chaotic? And so with that being said, whatever we propose, we need to begin to inject laws of economics, personal responsibility into the delivery of healthcare, or else it will never, ever be a sane system, if you may.
Yeah, I mean, while overall the Affordable Care Act is not a popular piece of legislation, there are pieces of it that people really like. Even Republicans say, kids being able to stay on their parents' insurance until the age of 26, pre-existing conditions, coverage, things like that. How, Dr. Burrows, is that made to work by keeping this?
Well, there are a bunch of things. I mentioned there were four major things that can't go. I need to quickly mention the other three because they're really important. One of them is the solvency of Medicare. The reason why you're eligible for Medicare at age 65 is the program was based on the original Social Security system in Europe when people died by the age of 65. Now 80% of Americans live till age 65, and once you get to 65, you're going to live another 20 years. Medicare would have been bankrupt this year without Obamacare. And we extended Medicare, which is a very important program for the elderly, based on two things. We decreased reimbursement to hospitals, and number two, we increased payroll taxes for employers and employees. So that was important. Number three, having affordable insurance in our state. I don't know if you remember, but before Obamacare, there was one insurance company that was able to underwrite healthcare insurance in New Hampshire, and that was Anthem Blue Cross and Blue Shield. Now there are multiple companies, and there's real competition in New Hampshire. That's important. And finally, we have to pay doctors and hospitals to do preventative health care. I'll give you an example, heart disease. The number 1 and 2 cause of heart disease deaths in America is smoking and obesity. But there's almost no money to pay for that stuff. And we've got to change the way we pay doctors and pay hospitals so that we pay them for prevention and not just for taking care of sick people and doing procedures.
And prevention is right in your wheelhouse. I love your analogy. I mean, insurance should be like car insurance. The better, you take care of yourself, cheaper the insurance should be.
Yeah, as we look for solutions, healthcare should look like auto collision. All right, you should be covered for the services or the problems, if you have health problems, that you wish to be covered for. And for an example, why am I paying for bariatric surgery? Why am I paying for transsexual surgery? I shouldn't be. I don't want it, because I don't believe I'll confront those situations.
Now, you've mentioned that the big hospitals have been able to absorb the negative impacts of the Affordable Care Act much better than smaller providers.
Absolutely.
Bedford Ambulatory Surgical Center. So moving forward, what needs to be done to level that?
We need to begin a process in which healthcare providers truly compete on a level playing field for healthcare services. And until that happens, you're going to have ridiculous prices. Let's talk about the MRI. Why is in this marketplace someone getting $3,500 to $5,000 for an MRI and someone else is getting $600? And the $600 one, by the way, is better technology. Okay, and interestingly enough, the radiologist reading the MRI gets paid the same no matter where that patient goes.
But the patient doesn't know that. Patient doesn't know what
No, that's exactly right. So we really want to correct the foundation of healthcare, which is, all right, employer-sponsored healthcare. We shouldn't be buying our healthcare through our employer. It should be your own policy. Thus, it's transportable as well. Your employer could contribute to it through tax incentives and the like, but without question, you should own it.
And do you agree with that? I mean, big picture, as Republicans in Washington start to tinker with the ACA, what's your best case scenario and what's your biggest concern?
Well, my biggest concern is there won't be a replacement at the time of repeal.
Right.
Because there are a lot of people who feel there's going to be a meltdown in the insurance industry, and a lot of people feel that up to 32 million Americans won't have access to health care. Now, why is that such a big deal? When Mitt Romney was running for president, he said, well, these people can go to an emergency room where they have to take care of these people. But I can tell you, if you have a chronic disease like cancer or you have hepatitis C, the out-of-pocket cost could be $50,000 to $100,000 a year. And by the way, health care is the #1 cause of personal bankruptcy for Americans who are employed today. The average American has basically 3 months cash on hand if you were to stop their paycheck tomorrow. And healthcare is the #1 cause of personal bankruptcy. So I'm a little different than Nick, I think everyone should have health insurance, not because they should be forced to have it, but because it makes good economic sense, and it actually saves money for everybody and protects them from being without health insurance when they could have a life-threatening condition at any point in their lives.
Nick, I mean, we have a couple of minutes left. What is the best case model that you think that the Republicans need to identify?
The best case models, there are models out there in Switzerland, South Africa, okay, where basically you own your policy. And in fact, you choose the type of coverage that you wish to have, okay? And at the same time, you should be totally aware of your services before you get them as to what they cost, and the quality for that matter. Okay, the technology exists. If I were king, I'd put an all-out effort, as if we were, attacking polio or putting a man on the moon, to create transparency in the cost and price of healthcare.
And education too. I mean, you can't stress that enough when it comes to the patient themselves, patient understanding.
Right, but they can't be educated unless that transparency exists. I mean, we talk about personal responsibility. One of the arguments of the high cost of healthcare, people aren't taking responsibility. They can't. How the hell do you shop? Okay.
We're moving to a new era where patients will have access on comparative costs of healthcare throughout the country and the comparative quality of practitioners and healthcare organizations. You can already get that on Healthgrades, you can get that on ProPublica, you can get that on Leapfrog about patient safety ratings. Increasingly, the consumers are going to be more savvy about cost shopping as they become more acting like consumers, comparative shopping, so they understand the comparative quality and cost, and they can make more informed decisions.
Give the first word to Dr. Burrows. You have about 30 seconds. Anything else you want to add to this as we move forward?
Yeah, we are incredible. Think about it. We can shop almost any item you can think of, but you can't shop your health care. And that's by design. Okay, that is by design.
So patients, consumers, customers, however you want to characterize it, need to take control of their own health care. We'll see how it goes, guys. I wish we could spend more time talking about this, but it is what it is.
Thank you, Josh.
Thanks very much. We'll be right back with more. Stay with us.